Hi, my name is Crystal. I'm a student nurse at the Curtain for Privacy. Today I'm going to be doing a head-to-toe assessment, and I do have active orders to do so. Can I have your name and date of birth?
Rowan, January 1882.
Okay, Rowan, do you have any allergies?
No.
I'm going to wash my hands. I don't need gloves to start off, but I might need them later, so we're going to go ahead and start with the eyes. So have you noticed any recent changes in your eyesight?
No.
Do you have glasses or contacts?
No.
Any eye surgeries?
No.
Okay. So I'm looking at the eyes for the eyelids and the eyelashes, and nothing looks abnormal. Everything looks good. So then I'm going to go ahead and look at the conjunctive and the sclera. And the sclera is white like it's supposed to, not red or pink. And then I'm going to go ahead and look at the direct and indirect consensual. So dilates when there's light in it. Okay. And then we're going to go ahead and have you look at my light, and then look behind me, and then look at my light, and then look behind me, and it constricts when it's looking in front, and then dilates when it's going behind me. So then we're going to go ahead and tell me when you can see my light.
No. No.
Okay, so then we're going to go ahead and check your six ocular movements. So up, to the side, down, up, side, down. And then I'm going to go ahead and have you read this for me.
Hello.
So then now we're going to go ahead and look at the nose and the mouth. So I'm looking at the nose, and it doesn't look like it's been broken. No discharge. It's a normal color. So we're going to go ahead and look up at the nose cavity, and no drainage or abnormal bumps. So then I'll have you cover one side of your nose and breathe out on the other side. And then we're going to go ahead and look at your sinuses. So tell me if you feel any pain when we're doing this. We've got the maxillary.
No.
And the frontal.
No.
We're looking for any swelling, pain. That's good. So then we're going to go ahead and looking at the outer side of the lip, and it's pink like it's supposed to be. And then I'll have you open your mouth for me. And we're looking at the inside of the gums and then the teeth, and there's no bleeding, and everything looks good and pink like it's supposed to. So we're going to go ahead and have you open your mouth, and I'm going to have you do your tongue and move it. And then we're going to look at your tonsils and your oropharyngeal, and then that's good. So then I'm going to have you swallow for me, and I'm going to inspect your trachea. Okay, and then we're going to go ahead and do the lymph nodes. We have the occipital, the postauricular, the preauricular, submental, submanular, superficial, or the superclavicular, the superficial anterior cervical, the posterior cervical. And we're going to go ahead and look at your ears. So have you noticed any changes in your ears,
No.
your hearing lately?
No.
Do you have any tubes or hearing aids?
No.
Is there a problem with hearing within your family?
No.
Okay. So then we're going to go ahead, and I'm going to inspect your auriculars and look for any lumps or bumps, and I don't see any abnormalities. And same with the other side. So then we're going to go ahead and fold in the pinnas and tell me if you feel any pain on the tragus and the mastoid process. And no pain there. So then we're going to go ahead and look into the ears. Look at the tympanic membrane. And it's gray and pearly like it should be. Gray and pearly like it should be. Then I'm going to go behind and tell me where you can hear my fingers at. Okay, and hearing is good, nothing abnormal. And then I'm going to look at your skin, and we're looking at your skin and your arms, and it is warm to the touch. Skin color is good and tan. It's not dry. It's nice and moist. So then we're gonna go ahead and do the tutor, and it's rapid bounce back. So then we're gonna go ahead and look at the fingers and the nails, and the nail beds look good and pink, no bumps, nothing abnormal. We're gonna go ahead and do the capillary refill, and that fills within 3 seconds, and we would also do it on the toes as well. And then we're going to move to going to look for edema in the legs, and that is a scale of 1 to 4. So 1 with a 2 millimeter, and then 2 with a 4 millimeter, 3 with a 6 millimeter, and 4 with an 8 millimeter. And we don't look like we have any here, so that is good. Then we're gonna go ahead. We were looking for at the peripheral veins while we were looking at the legs, and nothing looked abnormal down there for it. And then we're gonna go ahead and I'll have you put out your arms for me, and we're looking at for contractures or tremors, and that looks good. Then we're gonna go ahead and look at the joints. I also didn't see any signs of phlebitis, but if we did, that would be, I went over that already. Warm to the touch, no swelling, all that stuff. And then we're going to palpate and look at the muscle strength. So can you tell me if this hurts or you feel any pain? Any pain in this?
No.
Not any pain, or
No.
nothing was warm to the touch within there. So we're gonna go ahead and look at your muscle strength. So I'm gonna do your sternocleidomastoid, and then I'll have you shrug your shoulders with your traps, and then your deltoids. Don't let me push down, don't let me push up. And then we're gonna go ahead and put your arms like this. Don't let me push them in, don't let me pull them out. That's your biceps. Pull your hands up, don't let me, this is your wrist, don't let me push back, don't let me pull forward. And then I'll have you put your fingers out like this. Don't let me push them forward. Together, don't let me pull them together. Don't let me spread them apart. Then we're gonna go ahead and do your hip adduction and hip abduction. So don't let me pull them apart, don't let me pull them together. Then we're gonna do your hamstrings and your quadriceps. So don't let me push them down, your feet down, don't let me bring your feet up. And that's good. So then we're gonna go ahead and I'll have you stand up, and we're going to look for signs of, and then I'll have you turn around or bend down. So we're looking for any abnormalities in the back, and that would be bending of the spine at the top or the bottom, and she looks like she's good with symmetry in the spine, and there's no signs of scoliosis, lordosis, or scoliosis. So then I'm gonna have you walk that way for me and come back, and your gait looks good. Your base of support is good. Don't let me push you back. And I'll have you sit down for me. And then we're gonna go ahead and have you stand up actually again, and we're gonna do your gait. And I'll have you walk that way, and we're going to look for the Romberg test and that swing of the arms, and I don't see any. Gait's good. So then you can sit down. Can you tell me what where you're at?
Southwest Tech.
Do you know what time of day it is?
11 o'clock.
Do you know what day it is?
Friday.
And do you know who the president is?
Donald Trump.
Okay, memory is good. So then we're gonna have you take your shoe off for me. We're gonna test for the Babinski reflex, and this would be a neurological assessment. But she's ticklish, so her feet are gonna bounce back. And then it would be curling of the toes if there was a Babinski reflex. That'd be a neurological deficiency. So then we are going to do the 12 cranial nerves. So I'll have you close your eyes and take a smell and tell me what this is.
Alcohol stuff.
So then that's the olfactory. The optic was when we had her read this and said hello. And then we had the optic nerve, the optical motor, the trochlear, and the abducens, which would be eye movement when we did with the 6 ocular movements. And then we have the trigeminal. I'll have you close your eyes for me. Tell me where you feel this, and then this, and this. And then it would be And then we were going to do facial. Can I have you smile for me? Can I have you frown? And then we're going to do the glossopharyngeal in the vagus, and that would be have you say ah. And then gag would be the glossopharyngeal. And then I would have the patient swallow, and this is the accessory and the hypoglossal. She swallowed. And then we would do, I'll have you test your fingers to your nose for me. And that's good. Balance is good within there. No neurological deficiency. So then we're going to go ahead and move to the respiratory. And we're going to have you noticed any troubles breathing?
No.
Do you have asthma?
No.
And then do you catch yourself out of breath when just walking short distance?
No.
Okay. And then we're looking at the ratio from her chest to her side. So it should be 2 to 1. And then we are going to have her turn to the side, and we're going to look for signs of scoliosis, lordosis again, and kyphosis, and that would be abnormalities of the back and no curving of the spine, and so she is good. And now we are going to go ahead and she doesn't look like she's struggling to breathe whatsoever, so I'm just going to go ahead and palpate the thorax, the posterior thorax. And can you say, do you have any pain back here?
No.
Can you say 99?
99.
And then we're going to do a chest excursion. Could you breathe in for me? Nothing abnormal there. Seems symmetrical. We're going to go ahead and listen. Can you breathe through your nose for me? Okay, and everything seems good there. And then we're going to go ahead and we're going to look at the front part of the chest. So we're don't see any abnormalities here. She's still breathing okay, so we're going to go ahead and palpate. And can you say 99 for me?
99.
Oh, okay. So then we're going to go ahead and listen. Take a deep breath through me throughout your nose. Out through your mouth. Okay. Breathing is good. Nothing's irregular. And then I would also ask you to breathe for me, so I'll have you look that way and breathe. Look that way and breathe. Okay, and then we're going to go ahead and move to the cardio part of the assessment. Have you had any irregular beating out of your chest from your heart?
No.
Abnormal pulses?
No.
High blood pressure?
No.
And is there any cardio problems within your family?
No.
Okay, so we're going to go ahead and I'll have you lay down for me. We're going to just look for jugular vein distension within the neck. If we did see any, we would elevate the head of the bed to 45 degrees and hope that it would go away. And if not, we would call the physician and we would take care of that right away. So then we would have you sit back up for me. And then I'm just going to look at your chest and see if your heart is beating out of your chest or anything, and I don't see any, so I'm going to go ahead and inspect. Do you feel or palpate, and do you feel any pain?
No.
No? Okay. So then we're going to go ahead and we're going to listen to your carotids, then we're going to listen to your heart. So take a deep breath for me. Take a deep breath for me. Okay, so then we have your aorta, your pulmonic, your Erb's point, your tricuspid, your mitral, and then we would hear the S1 best at the mitral, and the pulmonic would be heard best at the S2. So then I'm going to do your peripheral pulses. We have your temporal, your carotids, your brachial, your radial, your femoral, your popliteal, your posterior tibial, your dorsalis pedis. And then that's it for the cardio part of the assessment. So we're going to do an abdominal assessment now to finish. So I would ask the patient to urinate before the assessment. I'll have her slightly bend her knees. And then I'm going to go ahead and look from the side of the bed and look at the stomach for any distension. The symmetry's good. I don't see any bulging or abnormal lumps within the stomach. I'll have the patient raise her head for me. And I don't see any hernia within the stomach. So then I'm going to look and listen for vowel sounds and the visceral sounds. So in the quadrants, we're going to start with the vowels. So diaphragm. They seem high pitched like she just did. So we're going to go ahead and do the viscerals and the arteries. So we've got the renal, the aorta, the iliac, and then the femoral and the femoral. So then we're going to go ahead and percuss and palpate the stomach. So we would have the patient put her hand underneath my hands if she was ticklish. It should, with the light palpation, it should be 1 to 2 centimeters deep, and then I would I believe that is it. So after that, I would say, is there anything else that I can do for you? Do I have time? No? Okay, so I'd just be on the corner documenting.